Hello everyone, I am Dr. Suraj, Orthopaedic Oncology from SPARSH Hospital, Bangalore. July every year is observed as Sarcoma Awareness Month, not only in India but worldwide. So we take this opportunity to try to educate people about sarcomas, to bring in awareness about sarcomas.
Hello everyone, I am Pallavi from SPARSH Hospital. I am going to ask some common questions about sarcoma to Dr. Suraj. To begin with, I'll ask Doctor, what is sarcoma?
Okay, so sarcoma are cancers which arise from the connective tissue of the body. So connective tissues can be muscles, cartilage, bone, all these are called as connective tissue. So apart from the organs in our body like liver, lung, pancreas, stomach, etc., we also have connective tissue which extend all the way from the head to the toe. So any cancer which arises from these connective tissues are called as sarcomas. So if a tumor arises from the bone, it is called as bone tumor. If it arises from a soft tissue apart from the bone, it is called as soft tissue sarcoma.
So do all tumors are cancerous, doctor?
No, not all bone tumors are cancerous. If a tumor arises from one area, it does not spread or metastasize to the other parts of the body. So such tumors are called as benign tumors. Usually there is no threat to life with these benign tumors. But some bone tumors can be cancerous. We call them as malignant bone tumors. That is when a tumor arises from one area of the body and spreads to other areas, and then there is a relative threat to life because of the tumor. Then we call it as a malignant bone tumors. These malignant bone tumors are relatively rare when compared to commonly occurring benign bone tumors.
So doctor, can you tell us at what age do these bone tumors occur and where are they commonly seen?
Bone tumors can occur at any age group, but the most commonly seen malignant bone tumors, that is osteosarcoma and Ewing sarcoma, usually occurs in children who are less than 20 years old. Knee joint is the most common area where a bone tumor can arise from, but having said that, bone tumors can arise from any part of the body like shoulder, wrist, pelvis, ankle. They can be seen anywhere.
So I have heard that sarcomas are called as forgotten cancer. Can you tell me why is that?
Okay, that sarcomas are usually called as forgotten cancers because very less is spoken about sarcomas. When you switch on your TV or newspaper, you might have commonly heard about other tumors like lung cancer, breast cancer, a lot of head and neck cancers, a lot of things are spoken about them and it is easily available everywhere. But very less information is spread with regards to sarcomas. So the awareness is also on the lesser side because it is not commonly spoken about. And apart from that, the funding opportunities from the government, research activities from a lot of pharmaceutical companies are also on the lesser side in sarcomas. So that is why it is called as a forgotten cancer. Another reason why it is called as forgotten cancer, or the main reason, is the incidence is very less. So all bone and soft tissue sarcomas combined constitute less than 2% of all cancers. So it is extremely rare. So because of this rarity, less is spoken about and less is done with regards to this cancer.
So doctor, why is early diagnosis important in sarcomas?
Early diagnosis is very important. In fact, the most important factor in treating sarcomas, because when you look at commonly occurring sarcomas like osteosarcoma and Ewing sarcoma, which mainly occurs in children like I told you, so if you pick it up early, that is if we treat the patient promptly with the right chemotherapy and the surgery, before it spreads or metastasizes to other areas, the cure rate is around 70 to 80%. So 70 to 80% of these children can grow up to be like you and me. But if we treat the same patient once the tumor has spread to the other areas, then the cure rate reduces to just 20 to 30%. So this metastasis or spreading can occur in a period of weeks to months. So that's why picking up these sarcomas or diagnosing them early is one of the most important factors which improves the outcomes in these children.
So doctor, can you tell us what are the common signs and symptoms for sarcomas?
So most of these patients with sarcomas present to us with lumps and bumps. So these are swellings which occur at various areas of the body. So that's the most common presentation. So should we wary of all lumps and bumps? No. If a lump and bump or a swelling anywhere in the body is associated with pain, difficulty in bending the limb, difficulty in lifting your hand, difficulty in performing routine activities of daily living, or if you have other features like fever, difficulty in sleeping at night, so these are all red flag signs. So any lumps and bumps in your body with these factors, then you have to consult your doctor immediately.
So So can you tell us how is a sarcoma diagnosed?
Okay, so when a patient with a suspected sarcoma presents to us, first we take a proper history. We ask them since when they have been having the complaints. We take a family history, and then we proceed with imaging. Imaging involves getting an X-ray and MRI of the affected area. So once these are done, sometimes we also get a PET scan or a CT scan to see if that suspected tumor is spread to anywhere else. After this, we do a procedure called as biopsy. So biopsy is a very small procedure where we put a needle into the area where we suspect tumor to be. We take a small sample and we send it for histopathological testing. So there the pathologist observes the tumor under a slide and they'll be able to tell us as to if it is really a tumor and what kind of tumor it is. So this whole process takes about 7 to 10 days. So this is how we commonly diagnose a sarcoma.
So why is the diagnosis of sarcoma is dreadful?
So the diagnosis of sarcoma or any malignant bone tumor is dreadful or a difficult thing to digest for the patient and also the attenders is the treatment takes a long time. So when a patient is diagnosed with osteo or even sarcoma, usually we send the patient for chemotherapy where they give a lot of injections to shrink the tumor, to make it a little small, to make sure that it does not spread to any other areas, and also to make it easy for us to go in and operate. And then after the surgery, we send the patient again for chemotherapy. So this whole process in a malignant bone tumor takes to about 6 to 9 months. So apart from the physical strain or complaint, there is a lot of economic, social, psychological and financial burden to the patient and their family members. Hence the diagnosis of sarcoma is dreadful for the family members as well.
So doc, can you tell us how we can prevent sarcoma?
Unfortunately, we don't know, most of the times we don't know what is the cause for sarcoma. Unlike other cancers like smoking causes head and neck cancers, it can cause lung cancer, alcohol can cause liver cancer. So for sarcomas, most of the times there is no definite cause as to why it occurs. So hence there is no specific way to prevent sarcoma from occurring. But nonetheless, it's always better to adapt healthy lifestyles, exercise on a regular basis, eat home cooked meals, avoid radiation exposure. So all these general well-being itself can reduce the incidence of not only sarcomas but a whole lot of other cancers as well.
So doctor, can you tell us what kind of surgeries do you perform for a bone cancer?
Okay, so we perform something as a limb salvage surgery. In olden days, many decades ago, they used to amputate the limb, that is remove the limb itself. But these days, because of good chemotherapeutic agents where it shrinks the tumor very nicely, because of good MRI, imaging and surgical techniques and also technologies like 3D printing, navigation, we perform more and more limb salvage surgeries. So in these limb salvage surgeries, we go in and remove only the area of tumor or the part of the body which is affected and then reconstruct it with some other bone or an implant, which is usually a metal prosthesis. So this is called as limb salvage surgery. So these surgeries are not only to remove the tumor from the body, this is also to make sure that we give the best functional outcome to the patients. By functional outcome, I mean we should be able to make the patient to get back to most of the activities which the patient was used to, like walking, maybe jogging and even running sometimes. So this is also very important apart from removing the tumor from the body. So like I mentioned earlier, very little is spoken about sarcomas in general when compared to other tumors. So there's definitely a need to raise awareness among sarcomas, not only among general public but also healthcare professionals. So every year, the month of July is observed as Sarcoma Awareness Month throughout the world, where we try to create more awareness about sarcomas. You can also be a part of sarcoma awareness by talking about sarcomas to anyone you know who does not know much about sarcomas, be it your friends, your relatives or your colleagues. Just speaking about sarcoma itself can do a lot, because this information or message can reach out to a lot of other people beyond your reach by ripple effect. So you can also be a part of this sarcoma awareness. Thank you.